started running, oh gosh, it's probably been a little over 10 years ago, and it was mostly because of my family's history in heart disease. Both of my grandparents had a family history of heart attacks at an early age. My mother at the age of 42, I believe. My older brother had bypass surgery at the age of 40. My younger sister had a heart attack and bypass surgery at the age of 39. It's in the genes. I was training for the Bridge to Dam half marathon. I noticed that I was getting a little slower, a little more out of breath than I normally had been, a little more fatigued, achy feeling, a bronchial chest pain, not really a sharp pain, headaches up the back of my neck, and then finally I had some jaw pain, and that was the straw that broke the camel's back. We said, we got to go to the doctor. We saw Dr. Neal, and he immediately sent us to Dr. Khan. He had already had some history with me and my family, and so he just kind of put me on a fast track to find out what was going on.
He had blockages in the left circumflex artery. Then he had blockages in the obtuse module branch. And in addition to that, he had blockages in the left anterior descending artery and the right coronary artery. These patients usually do better with bypass surgery as opposed to having stents placed.
All of the staff were incredible and just took care of everything that we needed. Jen Weethup, a runner that we had run with, she was there with us every step of the way. We walked a lot, got me up, and they stressed the importance of it after I left and went home. And I tell everybody, it would have been a lot easier to stay in the recliner. I didn't want to get up when I got home and go for a walk, but I made myself get up and go for a walk, and every time I was done, I felt better. So it didn't change the fact that every time it was time to go for a walk, and I did it multiple times a day, I didn't want to do it. I wanted to just sit down, but I knew the benefits would kick in from my running, actually. You got to train for it. My family surprised me with some custom t-shirts that they had all made. It was a family event. My son, his wife, my daughter, her husband, the two grandkids, and Jill, my wife, we all did it together, and it's something that we'll keep doing together. Lake Regional, they showed me that bypass surgery isn't a horrible thing. I always looked at it from watching a family member go through it, and it was really tough. Something I had always dreaded and the hope that I would never have to go through, but I've learned that it's not a horrible thing. It's just a little time out to make you better. You'll bounce right back if you listen to your doctors.